boundaries that are not clearly set can also create opportunities for people to manipulate and take advantage of us. And I think this has happened in nursing in general. There has not been clear boundaries. We definitely were not taught how to set boundaries as a nurse in this profession that just wants to take from us. And so because we have given, there is now this like precedent of what is expected. And when that becomes, the norm almost, and we don't clearly communicate those boundaries for ourselves, some people will manipulate and take advantage of it. This really weaves in those people pleasing behaviors, and just our lack of boundaries as far as what we're willing to give others. And actually, as we begin to take notice of where we have not set boundaries and begin to do things differently to reflect our needs and what's important to us in our lives, some people will also take issue with this. So thinking about the people in your lives, right, that you have created this pattern of like, I always say yes, I'm always the one to fill other people's needs. When we start to shift and see ourselves in a different light and prioritize our needs in a different way, and we start to say no, and we start to really be clear about our boundaries, sometimes people can take issue with it. But again, it's important in how we communicate those boundaries, but also recognizing that even if we communicate effectively and clearly with people, we can't control other people's feelings or responses. And also to take into note is that the ones who tend to have the biggest issue with us setting boundaries are the ones who have benefited the most from us not having them. Let that sink in, right? The people who are going to have the biggest issue with you saying no are the ones who have benefited the most from you always saying yes. Like, just think about work. That's a huge example of it.